Rinse thermometer in cold water if kept in a disinfectant solution. Wipe dry with tissue moving from bulb to stem using a firm twisting motion. Shake vigorously to lower the mercury level. Pat dry axilla of patient. Place thermometer in the center of axilla. After leaving 8 to 10 minutes, remove the thermometer and wipe it once with tissue from fingers down to bulb using a firm twisting motion. Read temperature by rotating thermometer until the mercury level is clearly visible at eye level. Suppose they use tissue. Wash hands. Document temperature reading.
In checking the pulse, we're going to assess the patient's condition, determine the client's activity schedule, and after that, position the patient into comfortable position and also ask the client's activity within last hour. If we're going to check the pulse of the patient, we're going to note for rate and the strength of the pulse. The rate, if it is regular or irregular, and the strength, the pulse, we have to check that also. 0 means the pulse is absent. 1 is the pulse. 1 plus is means pulse is weak. 2 plus is the pulse is normal, and 3 plus is the pulse is bounding. And then we're going to check the pulse. Use the 3 pads of your fingers. Do not use the thumb because it has actually a pulse also. Use the three pads of your finger to palpate the pulse. It is actually below your thumb, and just feel it. Use a light pressure only. And after we're going to do that, leave the patient into comfortable position and document the findings. After I check the pulse of the patient for 1 whole minute, it is 68. It is normal, too fast, because the normal rate of pulse is 60 to 100 BPM. Next is taking an apical pulse. The first step is place the client into supine or left-sided position. Warm the diaphragm with your hands and place the stethoscope on the apex of the heart, which is actually or normally located in the 5th intercostal space, just below the nipples, and 3 inches on the left sternum. And this actually and count the rate for 1 whole minute when taking an apical pulse, and do not forget to assess the rhythm and check if there is any unusual sounds, and leave the clients in the comfortable position and document the findings.
Warm diaphragm with hands and place a stethoscope on the apex of the heart. Count the rate for 1 minute and assess the rhythm and any unusual heart sounds. Leave the client in the comfortable position and document findings.
After checking the pulse, we're going to check for respiration. If we are going to assess the respiration, do not tell the client that you're going to assess it or assess the respiration, because they're gonna alter the way how they breathe. So if you're checking the pulse, just leave your 3 pads in the radial, in the radial of the patient, so you can still assess the pulse and the breathing. And when you are going to check for the respiration, note the rate if it is normal, the depth if it is shallow or deep. The next is the rhythm, if it is regular or irregular, and the character. And we're going to check the respiration for 1 whole minute. Actually, other nurses, when they check the respiration of the patient, they just check the clothing or the drape of the patient, if they are going to check the rise and fall of the patient. But in our RD tool, it states like that we can put the patient's arm over the chest or the abdomen to check it. And one rise and 1 fall means 1 respiration. So when we are going to assess the patient's respiration, we're going to do it for 1 whole minute. After that, document the findings and wash hands.
Before the procedure, assess patient's condition. Place the patient in comfortable position, lying down with the head of the bed at 45 to 60 degrees angle. Count for 1 whole minute. Note rate, depth, rhythm, and character. After checking the respiration of the patient, it is normal. There is no unusual findings during my inspection of the client's respiration.
To check the blood pressure, first wash your hands and clean up the stethoscope using the antiseptic wipes. After that, determine which extremity is the most appropriate for reading. Do not take blood pressure reading on injured or painful extremity or one in which an intravenous line is running. And after that, select a cuff size. It is important because if you select too large or too small, it could throw off the result of when you are taking blood pressure. After that, explain the procedure to the client and place the patient into a relaxed position, and the arm should be at the level of the heart. Do not forget that. And after that, palpate the brachial artery because it is the artery where you are going to listen to the artery just here. And after that, wrap the cuff snugly smoothly around the upper part of the arm, above 1 inch above the antecubital space with the center of the bladder. And we're going to do our assessment.
After palpating the brachial artery, wrap cuff snugly and smoothly around the upper part of the arm. Place the gauge at eye level. Place diaphragm or bell of the stethoscope on the medial antecubital fossa.